Hello, my beautiful people of the interwebs. It is Medicare season again, and all over the television are these commercials. Something has just happened, just broke in the news that you need to be aware of, especially if you or someone you love, care about, is on or about to go on Medicare. I want to share with you the news, and at the very end, I'm going to give you some resources that you can plug in and find out exactly what these documents are. First of all, unfortunately, someone that I respected a great deal has now gone to creating commercials for Medicare Advantage with all the misleading components that would lead one to believe that all these benefits are available to everyone everywhere. At least that's my takeaway when watching this. Mike Huckabee is now the latest pitch man for Medicare Advantage. And then we have this semi-crazy actor lady. They call her 𝗲𝗏. If you've not seen that commercial, it'll blow you away at its utter sheer stupidity of over-the-top overacting. It's just amazing at the lack of intellect that they ascribe to the people that are watching these videos. And then William Devane has gone from, was it Roslyn Capital, trying to sell gold to everybody, and joined the pitch fest of Medicare Advantage. And then, of course, we have Jimmy J.J. Walker Dynamite with a new script this year, trying to be compliant as best he can. But did it meet the mark? No, I don't think so. And I'll give you an update that just literally happened last night from the Center for Medicare and Medicaid Services talking about these commercials. Pretty incredible, actually. And then we've got our old friend Joe Namath is back again, and all of his credentials that make him the perfect pitch man for Medicare plans. And that is, he was a pro football Hall of Fame quarterback, Super Bowl champion. So, of course, you should rely on the expertise and wisdom of someone who's probably not even on a Medicare Advantage plan for details about all the myriad of benefits you can get. So let's take a look. I don't want to show you the commercials. Maybe I'll do that in a future episode. But today, I want to share with you, there's a new marketing rule for Medicare that took effect in 2022 that says that your font on the small print cannot be any smaller than 12 points. Well, this is how they get away with it. This is literally what it looks like at the end of the commercial, where you can read what undoes everything that they just said in actually the commercial. So I'm going to zoom in here. This is Mike Huckabee's new piece that just came out. And let me sure this, go in here deeper. Now, can you read that? Let me be fair, make it even larger so you can read that. Plan and availability varies by carrier location. Medicare annual members can enroll in plan only if they meet certain criteria. Most of the benefits that they espouse are only available for dual eligible people. That is, a person who's on Medicare Advantage and Medicaid through the state. The combination of those two benefits gives all the giveaways to people. Is that most people? Absolutely not. But they lead you to believe that it is available to you in the commercial. That's the fast talking with benefits all over the screen. A licensed insurance agent will call you. Then it talks about benefits may be subject to limitations and annual maximums. You're not kidding. Then it talks about they can sell your information. They probably will, to another call center who will call you. And let's look at 𝗲𝗏. I'm telling you this, I'm going to have to do an expose on this video. It's the worst Medicare commercial thing I've ever seen. It's so loud in your face, but you can see the small print down there. That's what they're going for. And this is what it, and look at the alternative, the colors here, the color scheme, making it where you really just can't see what that is. But again, you zoom in here and it says, let's see, Barrington Media Group is the person, and they may offer you, let's see, your information to another person to call you on this. This requires coordination with the carrier for these approvals. Benefits may be subject to limitations. You betcha they are. And then this one I like. This is William Devane's commercial with a different organization, not Barrington, who's doing this color scheme where you can't read anything. See the colors there? At least this is black on white, and you can read this. Here's the small print from William Devane's commercial. And it says here, this company is owned by this company, Benefit Helpline, operated by Together Health, who cares, a health insurance agency, Together Health, or one of its companies, Total Insurance Brokers, LLC, another company, or Health Plan Intermediaries Holdings Company, another company, which are all part of another company, Benefit, Together Health, a licensed person may call you, and let's say you may be directed to one of our licensed agents from one of the 5 companies they just mentioned, or another third-party sales organization we may work with. So in essence, they're going to sell your information to another entity who's then going to continue to call you and call you and call you. Do you think that the pressure you're going to get to sign up will be immense? I can guarantee you it will be. And then Jimmy Walker's with the same organization that's got 5 different hierarchies there to sell your information back and forth. This is what just broke in the news. Let me zoom in so you can see it a little bit better. This is a memorandum to Medicare Advantage and Part D marketing companies that just came out pretty much on an emergency basis, because see, all the marketing criteria for the season is set in stone by October 15th when AEP starts for the year. Just a quick caveat. AEP, the annual election period, is only for Medicare Advantage and Part D drug plans. It has nothing to do with the Medicare supplement. If you have a Medicare supplement, keep it right where it is. Nothing's going to change, and you don't have to call anyone or do anything. The Medicare supplement automatically renews each and every single year, and the benefits on the supplement, unlike Advantage, benefits on a supplement never change. So you don't have to do anything about your supplement. We have thousands of people call us every AEP wanting to review what's changing and what choices they've got for their Medicare supplement. It doesn't happen. It doesn't change. Can't say that enough. But in this memorandum on this emergency basis from the Center for Medicare and Medicaid Services, let me just read you some of these amazing highlights of this. The Center for Medicare and Medicaid Services issues this memorandum informing Medicare Advantage organizations of CMS monitoring activities and sharing plan and sponsor best practices. This is the big part right here. This paragraph, let me zoom in so you can see better. CMS is concerned. They're concerned about the marketing practices of all entities. We have reviewed thousands of complaints, and hundreds of audio calls they've reviewed, and I've identified numerous issues with information provided to beneficiaries that is confusing, misleading, or inaccurate. That's what they're concerned about. That's why they're writing this late memo that literally came out at night. Our secret shopping activities have discovered that some agents are not complying with current regulation and unduly pressuring beneficiaries. Who's doing that? It'll tell you in the next paragraph. Watch this, those commercials right there. As well as failing to provide accurate or enough information to assist the beneficiary in making an informed decision. CMS reminds organizations that you are responsible for the marketing activities of your agents and brokers. CMS is closely monitoring marketing activities during this open enrollment period, including marketing that is misleading, confusing, or misrepresents a benefit or product, and will take compliance action against plans for activities and material that do not comply with CMS requirements. There it is. And this is interesting, and this is the crux of the problem right here. It says CMS has designated television advertisements as marketing material that qualifies for file and use. File and use is when you're going to run an ad having to do with Medicare Advantage. Again, none of this applies to Medicare Supplement. Don't need these kind of disclaimers. On Medicare Advantage, they can file this television commercial, and you can see the little number that's approved by CMS at the bottom. Well, it's not actually approved in most cases. See, you can file it, and then 5 days after it's filed, you can just use it. And they have up to 45 days to tell you to stop using it. Well, guess what? By then, you could switch the commercial to something else, couldn't you, if it was found to be misleading? File and use. Maybe just as a courtesy, we're going to file this with CMS. 5 days later, we're going to spend $1 million a week putting it out on every television station. So CMS is particularly concerned with recent national television advertisements. I don't know if you can read that, so I'm going to make it a little bit. There we go. This is what they're concerned with. This is why the memo's out. Particularly concerned with recent television advertisements promoting Medicare Advantage plans, benefits, and cost savings, which may only be available in limited service areas or for limited groups of enrollees. They overstate the available benefits, as well as use words and imagery that confuse beneficiaries or cause them to believe the advertisement is coming directly from the government. That's a problem. Due to these concerns, watch this, due to these concerns, as of January 1, 2023, next year, after the season, no television advertisements will qualify for submission under file and use. None. They have to actually be approved next year, not this year. This year, they're going to take compliance action against you after the fact, after thousands more complaints. And additionally, CMS will continue to review all previously submitted television advertisements to confirm that the materials meet CMS requirements. Television advertisements found to be out of compliance with applicable requirements must be discontinued when they get around to figuring out the fact that they were misleading, which comes after the fact that they do an investigation, which comes after the fact that somebody's made a complaint. So these advertisements have misled tens of thousands of people. And I highly recommend you not get your Medicare plan from a Joe Namath, Jimmy Walker, William Defoe, or Mike Huckabee, bless his heart. Let me tell you some news in Medicare Advantage, okay? Why am I so passionate about this? Because I've heard thousands of stories of people who've experienced the kinds of things like the Office of Inspector General has identified as a consistent track record within Medicare Advantage. Here's a new one that just came out. This is from Kaiser Health News. The article says, nursing home surprise. Advantage plans may shorten stays to less time than Medicare covers. After 11 days, this is the story here, after 11 days in a St. Paul, Minnesota skilled nursing facility, recuperating from a fall where she broke her hip, Paula, 97 years old, was told by an insurer that she should return home. Really? This seems unethical, her daughter said, who feared what would happen if the Medicare Advantage plan run by United Healthcare ended coverage for her mother's nursing home care. The facility gave her a choice. Pay several $1,000s to stay in this rehab that she needed, appeal the company's decision, or just go home. Healthcare providers, nursing home representatives, and advocates for residents say, what do they say? Medicare Advantage plans are increasingly ending members' coverage for nursing home and rehab services before patients are healthy enough to go home. Is this a limited thing? No. Half of the 65 million people with Medicare are now enrolled in these private health plans, not original Medicare. They're out of that. They're in private health plans called Medicare Advantage, an alternative to the traditional government program. The plans must cover at a minimum the same benefits as traditional Medicare. That's misleading. It's the same benefit categories, not the same exact benefits. The plans must cover, including 100 days of skilled nursing. But, huge but here, the private plans have leeway when deciding how much nursing home care a patient needs. This is not me saying it, right here. 𝗟𝗃, an attorney at the Center for Medicare Advocacy, a nonprofit law group that advises beneficiaries, said, in traditional Medicare, the medical professionals at the facility decide when someone is safe to go home. In Medicare Advantage, the plan decides. 𝗟𝗃𝗿, vice president of the National Association of State Long-Term Care, who directs the Connecticut office, said, people are going to the nursing home and then very quickly getting a denial and then told to appeal, which adds to their stress when they're already trying to recuperate. I said that 3 years ago when the first Office of Inspector General report came out and said that 74% of the time that you appeal and appeal and appeal and appeal, eventually it's overturned and you win. But in the meantime, you're trying to recuperate from something that's painful and long-lasting in many cases without the care that you're needing to get while you're going through various levels of appeal. The federal government pays, here's the problem, the federal government pays Medicare Advantage plans a monthly amount for each enrollee, regardless of how much care that person needs. They're getting paid anyway. This raises the potential, this is quote, the potential incentive for insurers to deny access to services and payment in an attempt to increase profits. Is that Chris saying it? That's according to the April analysis by the Department of Health and Human Services Inspector General. The incentive is to increase profits. Investigators found that nursing home coverage was among the most frequently denied services by the private plans and often would have been covered if under traditional Medicare. Many people are led to believe by insurance agents that only do Medicare Advantage plans that all the benefits are the same. You get A, you get B, you get D, you get this and that and all the thing. You don't. Guess who gets to decide when you get those services? Because they've already been paid. The health plan gets to decide. And the least they pay for you, the difference is that's their profit. And that's why the Office of Inspector General said that is the sole incentive of Medicare Advantage plans. The Federal Center for Medicare and Medicaid Services recently signaled its interest in cracking down on unwarranted denials of members' coverage. In August, they asked for public feedback on how to prevent Advantage plans from limiting access. Well, that's it. Just go ask the public, because they'll know how to limit Medicare Advantage plans limiting access. Jill Sumner, vice president of the American Healthcare Association, which represents nursing homes, said her group has significant concerns about large Advantage plans cutting off coverage. When someone's in pain, they can't even walk, they can't get up, and they're cutting off coverage. She goes on to quote, "The health plan can determine how long someone is in a nursing home, typically without laying eyes on the person." Two different worlds here. You got original Medicare, hopefully with a supplement plan. Go anywhere you want to, get all the care that's medically necessary without any prior authorizations or pre-approvals. Or Medicare Advantage. Medicare Advantage, you're outside of A and B, although you're still paying for it on B. You're outside of that with the freedom and restrictions of going anywhere you want. No, you've got a network, and anything you need like this requires prior authorization. Or just go ahead and go in there because it's medically necessary and then get denied, then get a bill. If members disagree, they can appeal. Spokesman for United Healthcare, who says it's all based on medical criteria. That's what we make our decision on. If the members disagree, they can appeal. That's what they literally said here. And I'll put the article in the description of this video. You can read it at your own leisure. If I stayed, this is another story. Patricia Maynard, 80 years old, retired Connecticut school cafeteria employee, was in a nursing home recovering from hip replacement in December when her United Healthcare Medicare Advantage plan notified it was ending her coverage. Her doctors disagreed with that decision. She just broke her hip replacement. If I stayed, I would have to pay, Maynard said, or I could go home not to worry about a bill. Without insurance, the average daily cost of a semi-private room in her nursing home was $415 per day, according to a 2020 state survey of facility charges. But going home was also impractical. I couldn't walk because of the pain. Maynard appealed. Good. Look at that. They've got an appeal. United Healthcare spokesperson Heather Soul said, "We can't explain why the company limited coverage for this article, but such decisions are based on medical criteria, and if the member disagrees, they can appeal." This one did. Appealed. Maynard appealed. And what happened? The company reversed this decision. Well, hallelujah. See, everything just works out. You just appeal when they haven't laid eyes on you and they just deny care routinely. See? But a few days later, she received another notice saying the plan had decided to stop payment. Again, over the objections of her medical team. The cycle continued 10 more times, she said. Maynard's repeated appeals are part of the usual Medicare Advantage appeals process, said Beth Link, a CMS spokesperson from the government, in a statement. When a request to the Advantage plan is not successful, members can appeal to an independent quality improvement organization that handles Medicare complaints. If an enrollee receives a favorable decision, the plan is required to continue to pay for the care. Residents who disagree can file another appeal if they're denied again. CMS cannot provide data on how many beneficiaries have had their nursing home care cut off by their Advantage plans or how many succeeded in getting their decision reversed. I can tell you, it was in the OIG study on appeals. 74% of the people who appealed, sometimes to the fifth level of appeal, finally got those things overturned, which means it was a bad call in the first place. But they put it off again. No, they're going to fight it. No, they're going to fight it. They're going to fight it. They're going to fight it. Or you just remove yourself from that whole conversation and say, I've got original Medicare that by God I paid in for 40 years of working my life. That's my Medicare. Don't take it away. And I'll put a supplement with it to close the gaps. That's the Medigap. And I can go anywhere I want to. Medically necessary and covered by Medicare. I'm good to go. That's the decision. And it never comes up when you're 65 and everybody says, I'm healthy. I'm healthy as a horse. I don't take any drugs. We hear it hundreds of times per week in here. I don't need to pay for a Medigap plan, a Medicare supplement plan. I'm healthy. Guess when things start breaking down? In our experience in 26 years of helping seniors now, I can tell you, It happens between 67 and 74. That's when we see the huge bell curve. There's a Canadian study that talked about that, disabilities in seniors, but I digress. At the end of the story, it said, when United Healthcare decided it wouldn't pay for an additional 5 days in the nursing home for Christofferson, she stayed at the facility anyway and appealed. When she returned to her apartment, the facility had billed her $2,500 for that period. After she made repeated appeals, United Healthcare eventually reversed this decision. I put eventually, that's not in there. United Healthcare reversed this decision and paid for her entire stay. Loomis said her family remains mystified by this ordeal. How can the insurance company deny coverage recommended by her medical team? Loomis asked. They're the experts and they deal with people like my mother every day. Because the difference is the profit. It's the profit motive. That's why. You're paying $0 for a plan. Ain't nothing free. Somebody's paying them. And the least they pay out in care, the more they keep in profit. It's just called math. This is interesting. The Mayo Clinic last week sent out a letter to all their patients and said what? What did Mayo say? Oh, Mayo warns it won't take most Medicare Advantage plans. Letter sent to Florida and Arizona patients suggests they enroll in original Medicare with a supplement. Why would Mayo Clinic say that? And this is a story by Cheryl Clark. She's an amazing medical reporter from MedPage Today online. You should really read MedPage Today. It's great. The story says the Mayo Clinic sent letters this fall to all eligible Medicare beneficiaries who received care at its facilities, Arizona and Florida, in the last 3 years, warning them that it is out of network with most Medicare Advantage plans. The letter sent to Florida beneficiaries said that marketing for Medicare Advantage plans may indicate that you can be seen at any facility that accepts Medicare. However, Mayo Clinic in Florida is out of network on these plans. And it goes on to say, they should enroll in original Medicare as well as Medicare supplements. Quote, this notice allows the patient to make an informed selection of coverage if the patient would like to seek a plan that has Mayo Clinic in network. Out-of-network care is not in the best interest of the patient and does not support Mayo's model of care. The letter advises recipients that the Mayo Clinic will not schedule appointments for patients with out-of-network Medicare Advantage plans. This is an interesting part of the article from Cheryl. Medicare Advantage plans have been under increasing scrutiny and investigation. She has a highlight there to a link. You can go watch that. Because so many of them have been accused by federal agencies of denying care, exaggerating the severity of illnesses to pull billions more from Medicare, and delaying care with lengthy prior authorization requirements. Wow. Additionally, unhappy enrollees who wish to disenroll then find out that they can't sign up for a supplement plan without going through underwriting. That's what I try to tell everybody. You have a choice when you're first eligible for Medicare. Go the road less traveled or go the wide open road with a free plan. After that window closes, they're going to have to ask you some health questions before you could qualify for Medicare supplement. Many people think, oh, I thought I could just go back and forth anytime I want to. No, I'm sorry, you got bad advice from the beginning. The underwriting, which could result in rejection of beneficiaries with certain common underlying health conditions. That's true. And let me just share with you part of this. The Mayo Clinic, known for its specialization in many conditions and its coordinated system of care, the Mayo Clinic's website, it says it cares for 1.4 million people each year with serious or complex illnesses from all 50 states and 140 countries. And here I hold in my hands the original letter that I first posted on the internet, and friends of mine on YouTube went to YouTube with it first when it first came out. But I wanted to put some more context into this before bringing it to you. This original letter says, we want to be sure that you are aware that Mayo Clinic in Florida will not schedule appointments for patients with out-of-network Medicare Advantage plans. Many patients are now making elections for their coverage in 2023, as you may be doing, including Medicare. Marketing for Medicare Advantage plans may indicate, however, we're out of network. And on the bottom it says, we do, however, we do, except original Medicare and supplement plans. Doesn't matter which company. Medicare supplement is a Medicare supplement. sometimes referred to as traditional Medicare. If you choose to enroll in Medicare Advantage, we can provide your medical records to the next in-network facility you select for your care. So if you do go on a Medicare Advantage plan, don't count on Mayo Clinic being part of the things that you can access. For those that are not familiar, quick recap. I've got a video from a congressman that goes off about this prior authorization part of Medicare Advantage in a second. You really want to watch that. Original Medicare is something you've paid into and you've earned your entire life. There is no hospital network. There's no doctor network. There's no prior authorizations. There's no referrals required to go to any specialist. However, the flip side of the world that you're seeing all the television commercials for, there is a hospital network in most all those plans. And it's a very limited network, just enough to be considered adequate for your area. That network can change any time of the year. If your doctor or your hospital, now we're getting news stories of hospitals leaving the networks for next year right now, if they leave that plan, that does not give you a special election period to get out of that plan. It doesn't. You have to go within their network that remains after your person left. They have prior authorizations required. I'm going to show you a video on that in a second. Referrals are required, and most are $0 premium per month. Wonder how they get that. This is a story a couple months ago. Medicare Advantage plans often deny needed care, federal report finds. Nothing new there, but what is new, and I want to show you, that is that website, allaboutmedicareadvantage.com. I've started chronicling all these stories, both from the government internal watchdog, the Office of Inspector General, the Department of Justice suing these companies for these fraud things, all of them on one site, and it's called allaboutmedicareadvantage.com. Chances are you know somebody on a Medicare Advantage plan, or you know somebody that's about to call a TV commercial with J.J. Walker in it. Please let them know that this exists as a resource. Allaboutmedicareadvantage.com. See the good, bad, the ugly. Just a few months ago, the American Medical Association agrees with recommendations from an investigation of Medicare Advantage plans. This talks about the Office of Inspector General's report that inappropriate use of prior authorization by Medicare Advantage plans that's been uncovered mirrors physicians' experiences. They're seeing the same thing. Surveys of physicians have consistently found that excessive authorization controls required by health insurers, Medicare Advantage, are persistently responsible for serious harm when necessary medical care is delayed, denied, or disrupted. The American Medical Association agrees with federal investigators' recommendations for preventing inappropriate use. Watch this.
Mr. Speaker, I'd just like to explain to the public what pre-authorization means. I'm a practicing physician, so if I order a test, I recommend a surgery. It then goes into a bucket at an insurance agency. And then we play the great waiting game. The patient's no longer in the office because we have no idea how long that waiting game is. It was put in and accepted for what I believe was a good cause. But as with many government programs or institutions of our bureaucracy in the private sector even, it's something that has gone bad and gone terribly wrong. I may be waiting two or three or 4 weeks to speak with somebody who's not my peer. I'm a surgeon. I may be speaking with a pediatrician, or even more, I might be speaking with a nurse practitioner who has no experience whatsoever in my field of study to get their approval of something that I know needs to happen. It's an absolutely antiquated system that does not work. And I'm going to give you a couple examples. Approximately 10 weeks ago, I saw a prostate cancer patient. There were 2 avenues to go on this. Either he needed to be operated on very quickly, or it was the cat was out of the bag and he needed intensive chemotherapy quickly. A week goes by, 2 weeks go by. What's that patient doing at home? He hasn't slept 1 wink because his entire future, his entire life is then suspended in front of him. It took 3 weeks to get the study that every urologist in the country knew was necessary to get that answer. Yet in the meantime, that patient has lost years just in life as far as worry. Because I look at the savings that we as physicians provide in knowing what's right for our patients in the moment versus some bureaucrat in an insurance company who's given the directive to deny is not what we should be doing in medicine. Our medical system has become bankrupt, and part of these pre-authorizations are part of it. This is decades past the time when this should have been done. I look at the doctors that I have worked with, and we're just plagued in clinic because we know what we're going to recommend for our patients after years of study and work with patients is going to be possibly been denied by someone who has no experience, who's been told by insurance companies, deny, deny, and deny until they wear out the doctor and wear out the patient. So, Mr. Speaker, this is a travesty, I believe, to not pass this bill.
Doctor, speaking to you on the floor of the U.S. House. How many times did you see that in the news? Probably not. So how many people are bringing you this up-to-date information on what's going on with Medicare without trying to sell you a plan that pays me literally double the commission that a Medicare supplement plan would pay? So I just want to remind you again, you got a big old choice. Every year, you get to choose to re-up with a Medicare Advantage plan. By the way, if you're doing that, if you're considering it, make sure you've looked at your annual notice of change that you should have received in September or October, because Medicare Advantage plans change every year. Their formulary can change, their network, their benefits, their max out of pocket, their restrictions, the formulary, the tiers, everything can change in those all-in-one amazing plans. However, if you do the Medicare supplement on the other side with original Medicare as the backbone and the supplement just filling the holes of Medicare, which is mostly the 20% on Part B costs, so you can go anywhere and not have to pay 20% of an unlimited bill. That's the benefit there. Those benefits never change. And we help with both, but obviously I lean to the side where we get no complaints. And that would be original Medicare with a Medicare supplement. We'll give you both sides of the story, no question about it. And you can do what you want to do. You can go where you want to go, and we'll help you as best we can. I just want you to know that there is an alternative choice that you don't get told by most of the agents that are out there. If you look for ads running to recruit agents today, you'll see that every bit of them is all about Medicare Advantage. Wait a minute. Let me go look at this. I want to show you something. Look at that. You think Mr. Huckabee, his organization is going to tell you about Medicare supplements? It's called Medicare Advantage Advisors, for goodness sake. That's all they're going to advise you about. All these little things here. Medicare Advantage, 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 Advantage. There's a story that I'll show you soon where an organization has literally filed a bill to try to get the word Medicare Advantage changed because it's not Medicare and it's definitely not an advantage. So if they could get that done against the insurance lobby on K Street, which is the biggest, most powerful lobby in Washington, that would be quite a hoot. But it has been filed, and it may go somewhere one day. We're in the business of helping people. If there's any questions that you have about your Medicare plan, don't know where to go, you're considering which plans to go with, we are what's called an independent brokerage. I don't work for one insurance company. We're contracted with a host of companies. We don't have all the plans in the market, and that's for a reason. We choose not to have all the plans in the market because I work my butt off on researching these companies, and we keep up with them every day in the news. What happens with Medicare? What happens with Medicare Advantage? What happens with Part D? That's all I study all day long, 7 days a week. So if there's a plan or a company or something going wrong, we're not putting clients with that. And we've got now 26 years of experience of looking at these plans, not just getting contracted yesterday with all Medicare Advantage and saying, which of these free plans would you like to sign up with? There's a huge financial incentive for somebody to do that. I recently recertified with my insurance license, the continuing education. We have to do it every 2 years. And there was a class on ethics that we had to take. And in the class on ethics, it literally talks about things like this. Small print. Small print is unethical when you're talking to a senior to determine the benefits that might be the difference between life and death. This, in my mind, in my humble opinion, for whatever that's worth, is unethical as hell. To put this information out there, flash it up there and say, this undoes everything that we just said, but go ahead and call us for a free review. And we'll transfer you to another agency. We'll give you a sales pitch. There's a better way. And I recommend you go with an independent brokerage that has access to both, but will honestly tell you the difference and make a recommendation, not just give you a slew of quotes. Nothing bugs me more than the insurance agents that I train that just constantly vomit out of their mouth. I'm going to give quotes. I'll give you quotes and quotes and quotes. Well, that's just like going to Medicare.gov and looking at a myriad of plans with absolutely no context whatsoever. Is this a good one? Do they have a good reputation? How long have they been in business? What's their AM Best rating? How do they treat their customer service? Do they outsource it to across the ocean? Do they have American customer service? Have you at Medicare gone to see their facility and walked around and see when they answer the phones when people call in? I have. That's the benefit of going through an independent broker. And oh, by the way, it doesn't cost you a dime to go through an independent broker and get a recommendation based on experience. It doesn't cost you anything. It's already built into the rate. So if you want to be a professor of insurance and go and study it for years, get your insurance license only to sell yourself at your own plan and go direct with an insurance company without the benefit of an advocate on your side, be my guest. There's just no point in doing so. You can benefit from our experience without any cost to you. So anyway, thanks for watching. Sorry it came off as a little bit of a rant, but it's probably from my old law enforcement days, and I hate to see victims get screwed over. I really, really do. And it's just happening in such a pervasive way right now. Literally, I was watching the TV the other night, and every commercial segment was a different pitch man or Martha for Medicare Advantage. Every single one. And it's ridiculous if you know the backstory. CMS says they're going to crack down. They said no more file and use for next year. And that's subject to change. One interesting thing that they did add is a requirement that all Medicare Advantage sales now be recorded so that they can actually go back instead of he said he presented this plan the right way. And then Martha said she had no idea what she signed up for, which is why they had tens of thousands of complaints last year from these commercials, and what they call rapid disenrollment. That means they signed up for a plan during the AEP period. Come January, they're like, what is this? What? If I get cancer, I have to pay 20% of the chemotherapy cost on Medicare Advantage? 20%? And I have to find an oncologist within your network so that I can get the benefit of only paying 20%? My agent didn't tell me that. Of course, they didn't tell you that. But before, it was he said versus she said. Now there's a requirement that all these calls be recorded. So in our office, I've only recorded my calls for 14 years. Every call, I can go back 14 years ago and pull it up and say, did I do it right? Did I not? That's how we get better. We listen to our calls. Now it's a requirement. If you're going to talk with anybody about Medicare, the call has to be recorded. And literally yesterday, CMS came out and said, if the person on the other end says, I don't want to be recorded, we have to terminate the phone call. That's it. We just can't help. I think it's possible this will bring a higher ethical standard when people know that there's going to be at least some level of accountability when these tens of thousands of complaints continue to come in, all about Medicare Advantage and most all about these misleading commercials. That's my opinion. That's only my opinion because I care passionately about seniors. If we can help you look at your Medicare benefits, let us know, but please be patient because every client we've ever had for the beginning of time tries to call us within the 7-week period. And it's very, very, very tough to talk to every single one. That's why we sent out a client email. You can see that email at seniorsavingsnetwork.org at the updates page. The email goes through, if this is your situation, do this. If this is your situation, do that. We have a website where you can look at drug plans available. It's approved by CMS to be direct to consumer, which means you don't even need an agent. You can see what we see. You could compare plans and you could sign up with plans there. So check that out. It's on the page. God bless you. Thanks so much for watching. Take care.